So CA125, you get your CA125s, I'm sure you're all very familiar with this. It has what's called a high sensitivity, but a low specificity, meaning, it can be quite elevated in things that are not ovarian cancer. So it's not particularly specific. Now, patients with quite a bit of ovarian cancer, it's usually going to be a little bit elevated, but that's not always true. So the fourth point down there, especially patients with low grade, it's not always a great marker for you. Some of you may find that it has been, but you may find that it's not. There's a few other types of epithelial ovarian cancer that doesn't always do a great job either, mucinous and clear cell. So while I think it is a helpful marker and something that we check just as an added piece of information, I really try and encourage patients not to sort of hang everything on that number because it can mean so many things. It can mean that cancer is starting to grow, but it can also mean you have an infection. I have a number of patients who had COVID or a bronchitis or a GI bug or something else that makes it go up. Diverticulitis recently just happened to one of my patients, and then it comes back down. So not to provide necessarily a sense of false hope, but I think that we just have to be very mindful when we get that number back. And it's also not quite as helpful in small volume disease. If you have just a little bit that you're kind of following, it may still continue to be normal. And then really the other big picture is that CA125 measurements kind of over time haven't been associated with that thing we care about, right, the overall survival number. Again, we still do it, but it's not a perfect test by any means.